Well, good afternoon. Thank you all for joining us here today. It's nice to see you all in person, up close, which we haven't done in some time, for today's COVID-19 media briefing. Today's briefing is a little different than our typical community update, as we have come together to recognize and commemorate the one-year anniversary of the first COVID-19 case and the coronavirus arrival here in our community. I'm pleased to be joined today, as we were just a year ago, by my partner in government, Mayor Lovely Warren, our Public Health Commissioner, Dr. Michael Mendoza, Dr. Michael Apostolakis, the Chief Medical Officer of the University of Rochester Medical Center, and Dr. Robert Mayo, the Chief Medical Officer at Rochester Regional Health. It's hard to believe that just a year has passed since we received confirmation of our first confirmed positive case of COVID-19 here in Monroe County. At the time, we knew things were going to change. We knew things were going to be a little different. We just didn't know exactly when and exactly how. I still remember the uncertainty we felt after getting the news, that the first questions it presented, the answers that we had, and in many cases, the answers that we didn't. Just 2 days after our first case, we had our second. And with that came the difficult decision to close our schools for the foreseeable future. From there, things really did start to change day by day, and sometimes hour by hour. As a community, we were quickly forced to adapt to a new way of life, a new normal. Working from home, learning from home, isolating and keeping our distance from our friends and families, Zoom meetings, FaceTime chats, and even worrying about running out of toilet paper and other essential products. The unknown was ever present. When would we be able to see our families again? When would our kids go back to school? When could we return to work? So many questions, and early on, too few answers. Thinking back to the many stories and many life-changing occurrences that we all experienced over the last year, it's really impossible to reflect on all of it and to think about every single thing we went through. But what stands out above all else over the course of the year is the way every aspect of our community banded together during uncertain and difficult times. Our two hospital systems, which are not only two of our largest employers, but they're also competitors, work together to develop surge capacity plans, to work together to meet the healthcare needs and challenges that face our community, to coordinate their policies, their visitation policies, their medical response, and developed critical messaging to maximize available information and minimize confusion. They did this for the good of our community, and it helped us get through some of our most difficult and challenging times. Our government partners from across the county came together. We shared information. We talked to each other every day from across party lines, across the entire community, to assist in distributing items like PPE, standing out in the cold, to assist our neighbors, to talk to our community and provide critical feedback. Our business community, like Black Button Distillery, completely changed their production to help produce critically needed supplies like hand sanitizer, which were in short supply. I was just remarking, think of it, a little bottle like this didn't even exist a year ago today. The United Way created a donation and volunteer portal almost immediately to raise funds and connect people to ensure services were still available to those in our community who are in most need. And in a very beautiful way, everyday people across our community stepped up to lend a helping hand in any way that they could. From homemade face coverings and helping neighbors acquire needed groceries, to discovering new and unique ways of celebrating holidays and honoring our frontline workers and healthcare heroes, our community found new ways to come together despite the physical distance that was required. More than anything else, the togetherness and community spirit ran deep during those early days and weeks of the pandemic, and it helped many of us get through our toughest days. Of course, no COVID-19 recognition would be complete without honoring the dedicated healthcare workers, essential employees, and other frontline staff that have been keeping our community safe and healthy over the course of the last year. From the healthcare professionals at our two major hospital systems, the nurses, doctors, support staff at private practices, our FQHCs, the dedicated men and women at the Monroe County Department of Public Health, our first responders, our grocery store workers, and everyone who has continued to do their job to keep us safe and keep life moving. We cannot thank you enough for your selflessness, your dedication, and for putting the needs of your community ahead of your own. But through all the partnership and coming together, our community too has experienced an unbearable amount of heartache, loss of life, and pain and uncertainty. Since that first case on March 11th, 2020, we've reported 52,751 confirmed positive cases. Our peak of daily new cases came on New Year's Day of this year, when we reported 802. We've suffered an unimaginable 1,173 deaths from COVID-19 over the last year. That's 1,173 husbands and wives, brothers and sisters, sons and daughters, aunts, uncles, friends, and members of our community. We will continue to remember all of those who have passed as a result of this terrible virus and lift up their families, friends, and loved ones through our thoughts and prayers. Our hospitals at times had been stretched to the brink, with our peak hospitalization coming on December 28th, just days after Christmas last year, when 964 people from our Finger Lakes region were in the hospital fighting COVID-19. Our peak ICU numbers were just a few days later when 172 people were reported in the ICU. There were times in November, December, and January when we hit our second peak that it felt like we would never reach the end. But we're here today with a renewed sense of hope and encouragement, with a light shining at the end of this long tunnel. Our vaccination efforts continue to expand, with more and more people in our community becoming eligible and an increasing supply that we are able to get into arms. It's remarkable to look back at the uncertainty we were feeling just one year ago and to think about just how far we've come in such a short amount of time. We stand here today at a COVID-19 vaccination center that gives us that sense of hope and optimism. As of today, 86,370 people in Monroe County have completed their full vaccination series, and 170,339 people, or 23% of our total population, have received at least one dose of the vaccine. That was unimaginable just a year ago that we would be in that position today. The facility we're standing in, the Rochester Riverside Convention Center, that we have converted in the county's main operations center, is administering thousands of vaccines every day. This effort would not be possible without the hard work and tremendous dedication of the county staff and volunteers working long hours to get shots in the arms as quickly as we receive them. And I want to take a minute to ask all the men and women from our team here at the pod who set up this convention center in 2 very short weeks from that conversation. Please raise your hand and be acknowledged by all of us, and thank you for your hard work. When combined with the county's vaccination pod at the Fleet Center and the many other vaccine locations such as the Dome, the new FEMA site at the former Hawkeye site, clinics run by the many healthcare providers in our area, and so many others, the path out of what we have experienced of the past year is becoming clear. And that's why I asked and I wanted to bring everybody here to this location, and I thought it was very special to have you here today. A year ago, this group of people who I'm standing with gathered to address the public amidst uncertainty, to talk about what we knew we were going to be facing and what we didn't know we were going to be facing. Today, this very group of people is standing in a place of hope and standing in a place to address you of resiliency, of hope, and fortitude to end this pandemic in the coming months. This good news is also buttressed by the additional federal aid that's on its way, thanks to Congressman Morelli, Senator Schumer, Senator Gillibrand. Not only will we be able to double down on our vaccination efforts, but we will begin to focus on what comes next. How are we best going to be able to support our residents, our constituents, our businesses, those who call Monroe County and the city of Rochester home as we rebuild and we come out of this pandemic so that we are stronger after than we were before it started. As we reflect on the last year and the tumultuous times we faced, we can confidently look forward with a renewed sense of hope. We have the opportunity to come together once again as a community to help each other and ensure that we emerge from this pandemic stronger and more united than we've ever been before. 365 days ago, we were scared, we were alone, and we were unsure of what was to come. Today, we know what lies ahead. I am incredibly grateful to this community for coming together and for the hope that we have brought to so many families in our community. Thank you. I'd now like to invite up Mayor Lovely Warren, our partner in fighting the pandemic over the course of the last year. Thank you.
Thank you, County Executive Bello, for your leadership, for your partnership, and all that you have done to ensure that our community continues to fight the pandemic, continues to get vaccinated. I truly appreciate it. I am pleased to be here on behalf of the citizens of Rochester to honor and remember the beautiful souls who lost their life and whose lives were cut short due to the coronavirus. As many of you know, my beloved mom is one of those thousands whose memories remain in our hearts, and it's certainly up to us as a city and a county and a community to acknowledge and pay homage to every life no longer with us. A year ago, I did not think that I would be here, standing here, having lost my mom to this virus. It's hit different because I couldn't visit her in the hospital. I talked to her through the phone. When she was put on the ventilator, my sister and I watched through FaceTime. The woman who gave us life, we couldn't hug her. Like so many other families across this country, it's different, this death. And although we are a family of faith and we know she gained her wings, our lives were forever changed. I think about the citizens in nursing homes and hospitals, secluded, quarantined, and lonely, not able to feel the warm embrace of their loved ones, with no choice but to pass away alone from heartbreak. Everyone who walked the same path that my sister and I had to walk, lives will forever be changed. They will never be the same again. Hearts shattered, but wanting to move forward. I think about the unyielding sacrifices of our healthcare workers, our essential workers, our first responders, our members and our teams that worked at the county and the city, how they showed up every day to serve, to help make a difference in the lives of those in need. The financial uncertainties for our families and business owners, coupled with the anxiety at the thought of contracting this virus and losing someone, is trauma. But what gave me hope is a team, is our city and our county coming together, our leadership working, fighting every day so that we could overcome this barrier. That gave me hope that we were able to provide food to our children, that we were able to provide tests to our people, that we were able to help our businesses, able to help our restaurants come out on the other side of this pandemic stronger. I have to tell Dr. Mendoza that I am so thankful for your hard work. You really led us through some tough times. And although it isn't over, I know that you're working very hard with the county executive to ensure that we get the vaccines that we need to make sure that our county is the safest county in the United States of America. I'm grateful to Rochester Regional Health and the University of Rochester Medical Center for their research and dedication, and most of all, for all the healthcare workers and professionals who remained on the front lines in the fight against this virus. This is a noble example of how we came together to make progress towards an equitable community where all of our residents have access to life-saving testing, vaccinations, and ultimately a better chance to live a quality of life. So no other family member has to live with a broken heart. March 17th marks 1 year since our first citizen was taken by this virus. And almost 1 year later, we remain steadfast in our efforts to remember those we've lost. I want to thank Dr. Archie, who joins us here today, for leading our real rapid response team and making sure that we keep equity at the front lines when it comes down to getting our people vaccinated, and of course, our commissioner, Dr. Danielle Lyman-Torres. Our communications team, thank you so very, very much for all the hard work that you have done to ensure that we protect our circles. I am proud to stand here today to serve with you all, to sign this joint proclamation in memories of the loved ones that we lost and in protecting the people that we've left behind. It is my pleasure now to introduce the man that led us through this tumultuous time, who gave us hope when we thought that there was no tomorrow, Dr. Mendoza.
Thank you, Mayor Warren. It is my pleasure to join you, our County Executive Adam Bello, and my colleagues Dr. Apostolakis and Dr. Mayo here today. I want to take a special moment to thank all the members of our media who have joined us here today for the first time, and I can't remember how long. It is great to see your faces in person, and it reminds me of the community that we have here in Monroe County and the community that we look forward to rebuilding once this is all said and done. Before I begin, I also want to take a moment to recognize the thousands of people in this community who have lost a loved one, a friend, a colleague, a mother, a co-worker in the past year due to this deadly virus. Nothing will replace the humanity that we have lost, but I am hopeful that the spirit of all of us here today, as we come together 1 year later after the beginning of this pandemic, will lift us all up and hold all of these loved ones in our memory. Nearly 1,200 people have died, leaving behind their sons and daughters, their mothers and fathers. For you, this pandemic has been especially cruel, and my heart goes out to each and every one of you. It has been a very difficult 12 months, difficult in ways we never could have imagined when we gathered 1 year ago today. So much of the life that we cherished was suddenly swept away. Holding the hand of an aging parent, high school football games in the crisp autumn air, a room full of kindergartners joining for the first day of school, meeting friends for dinner. These simple pleasures and so many more have been stripped away. And of course, beyond these simple pleasures, very real circumstances, businesses suffering, people lost their livelihoods, and we had to learn to live with the incredible uncertainty day to day, week to week, and month to month. The impact of this, especially on our mental health, will undoubtedly last for years, the full impact of which may never be fully known. In the midst of all of this trauma, however, we have gained. This community, long known for its silos, gained an unprecedented spirit of collaboration. We knocked down walls, and we built partnerships that only a crisis could bring to fruition. We gained a sobering awareness of the long-standing ills within society. We saw how our broken systems, racism, economic disparity, have all led to unequal outcomes, hurting our most vulnerable, and in turn, hurting all of us. We gained a new appreciation and understanding of science, how we must honor, respect, and value science in our decision-making, how we must be patient as it evolves, and how we must hold sacred the facts and evidence in our communication with an uncertain public. We gained resilience. We were able to hold on to hope. And as I stand here before you today, there are many reasons to be hopeful. Not long ago, having a vaccine was something on the horizon, but now we are vaccinating thousands of people every day in facilities like the one we are standing in here today. Changes in guidance from the CDC and from the New York State Department of Health are now adapting to our feedback, thanks to feedback from communities and members of our community here in Monroe County. We will soon be enjoying warmer weather, warmer days, and more freedom to socialize in safer and more COVID-friendly ways. But we are not over this pandemic yet, not by any stretch of the imagination. Now is not the time to take off our masks or let down our guard. But it is time to reflect on what we have been through. We must hold on to what we have gained and learned from it. We must celebrate how far we have come. Indeed, we should all look around at how lucky we are to be alive right now. Finally, I want to say a simple thank you to all of you. Please encourage your family, your loved ones, your neighbors, your coworkers to get vaccinated as soon as it is available to them. And with that, I will turn things over to my colleague, Dr. Robert Mayo, Chief Medical Officer at Rochester Regional Health.
It's a privilege to be here today with these esteemed leaders and colleagues and with all of you. It's fitting that we gather together to remember this past year and what it has meant to each of us and how it has impacted us. It's impossible to calculate the vast impact of this pandemic on each of us. I'm grateful for the words that have been said already because they capture the deep sentiments of my heart and I believe many of yours. But in spite of that, we have endured much suffering with the loss of dear ones, with those who today have the lasting impacts of COVID illness to live with, for the financial impacts upon our businesses and households, and the lasting concerns that this brings forward. This pandemic has magnified inequities in health care that as a community we need to overcome. This and many other things have magnified the importance of our human connections. Though I would never wish a pandemic on anyone, I am grateful for the things that we have learned together. And we must ask ourselves some questions. Am I a better person today than I was before this pandemic? Have I lessened the suffering of my neighbor, or with more heartfelt compassion reached out to a person who suffers? What have I done to make a difference in this world? And these are the questions that will live with us and that will change our future. I'm grateful to know that so many people in this community lived so well the effort to overcome this pandemic. And I don't know what the future holds for all of us, but I'm so encouraged and hopeful because of the expanding vaccine availability and receptivity and acceptance of the vaccine in our community. But whatever the future holds for us, I am confident in the strength, the resiliency, the collaboration, and above all, the goodness of this community. Thank you. I forgot to introduce my wonderful colleague, Dr. Mike Apostolakis, the University of Rochester's Chief Medical Officer.
Yeah. Thanks, Rob. It's an honor to be here today with our elected officials, Mayor Lovely Warren and our County Executive Adam Bello, as well as my colleagues from the Health Department, Dr. Mike Mendoza, and my colleague at Rochester Regional, Dr. Rob Mayo. This is the biggest public health challenge any of us have faced, and it's heartening to see how our community has pulled together to face it. I'm especially thankful and proud of the healthcare workers at UR Medicine. Since March 11th, when the county's first known COVID patient was tested at Highland Hospital, thousands of doctors, nurses, and staff members have worked tirelessly and courageously to meet the healthcare needs of our community and patients. As we stand here today, it's exciting to have 3 different vaccines that are all incredibly safe and effective in preventing serious COVID illness. Everyone who's eligible should schedule an appointment and get the shot with whatever vaccine is first available to them. But even as more people are vaccinated, we need to keep our guard up. We need to avoid a new surge of COVID. We need to continue to wear masks in public, avoid large gatherings, and continue good hand hygiene. Thanks for the reminder. As our community comes closer to achieving herd immunity, life will become closer to what it was before. In some ways, the delivery of health care will never be the same, and it'll be better in the future because of what we've learned from COVID. For example, we've gotten much better at preventing the spread of infection, both in the clinical settings and in the broader community. There have been almost no cases of flu this season because of the steps that the public has taken to protect itself from the spread of COVID. I mean, and that's remarkable when anywhere from 20 to 60,000 patients in the United States die per year from the flu, and we virtually haven't seen that at all this year. We know we can do it. And what we'll do next winter in the flu season, we'll have to see. The use of telemedicine has skyrocketed during the first surge of cases. At first, this was only a few providers who were seeing patients. But this has grown to rates that we've never seen before. And this better takes care of patients who have difficulty getting to their providers. This will continue into the future. I will also like to mention UR Medicine Home Care, which has helped hundreds of patients recover from their COVID illness after hospitalization. From physical therapy to nursing home visits or to nursing visits at home, making more health services available at home is what we'll see in the future. There's a lot more to say, but I think my colleagues have said it very well. So I'm going to end there so that we can all sign the proclamation and answer your questions. Thank you for your attention.
Okay, thank you. I'd like to close off here by thanking all of the men and women who are joining us here today, my partners and colleagues who are here with us from the beginning. I want to thank Dr. Mayo, Dr. Apostolakis, whose name I think I still got right-ish, from the year, oh, you left your mask, for your hard work, collaboration, going back just a year ago when we didn't really know each other, but we were doing press conferences about the flu and about the coming pandemic, which we knew may have been on the horizon. Dr. Mendoza, my right-hand man, who we really didn't know each other just over a year ago when I transitioned into this office, but we quickly became very close colleagues. I trust Dr. Mendoza, this community trusts Dr. Mendoza, and we owe him a debt of gratitude for the work that he and his team have done. And I, of course, want to thank Mayor Warren, my partner in government, for collaborating, working together as we fought this pandemic, as we worked together to help our constituents, and our teams really came together all across this community to make sure everyone had the resources that they needed to support themselves and their families. So I want to thank you, Mayor. Thank you, Dr. Mendoza. Thank you, gentlemen. And now I'm going to invite you all over while we sign a proclamation commemorating the one-year anniversary and the lives that this community has lost over the last year. Thank you. Sir. You guys far enough away, Doc?
I got my shot.
Oh. You're lucky.
What is our fear level right now as when it comes to COVID-19 in terms of a new spike? Because other states around the country are doing away with all restrictions and guidelines. It's a free-for-all in places like Texas, Mississippi, and places like that. What's our fear for another spike here? And of course, I mean, I know we're prepared, but...
No, it's important to remember that we are still in the midst of a global pandemic. There are still, every day, we're announcing close to 100 new cases a day. We still have people hospitalized, and unfortunately, we are still losing members of our community and losing lives here. So it is incumbent upon all of us that as more and more vaccine comes in, and we know how this ends, we know the vaccine is here, and there's a light at the end of the tunnel. It's still important to remember that we all have a responsibility to keep each other safe and to reduce the spread of the disease. That means we have to continue to wear our masks. We have to continue to use the sanitizer and keep a distance between each other. Not necessarily even just for your own protection. Even if you don't personally believe in it yourself, it's to protect those around you. We all have a personal responsibility to our community, and a big piece of that is keeping people safe. And I want to thank people. I know there's been politics and talk about mask wearing and COVID restrictions all across the country, but not here in Rochester. By and large, people are wearing their masks, they're doing what they need to do, and because of that, we have had better health outcomes than a lot of other communities across the country and across the world, and I give a lot of credit to the folks who live here for that.
And Dr. Mendoza, if
Yep.
you don't mind, I just have a follow-up question. Governor Cuomo announced quarantine for domestic travel will no longer be required starting who want to get away with their kids?
I think the fact that we're standing here today is a testament to how much we've learned. And had you asked me that question 1 year ago, I'm not sure I'd have the same level of confidence that I have in my answer today, which is that we need to keep doing what we know works. Wearing our masks, maintaining our distance, using our hand hygiene as appropriate, and now getting our vaccine as soon as we can. We have tools against this pandemic that were just a dream, really, a year ago. And so while there is some uncertainty about the variants and the impact to which travel might cause a change in our cases, the reality is we know how to beat this, and we've shown that we can do it. And so I think this community will rise, as it has for the last year, with the knowledge that we've learned, with the confidence of the community behind us, and I am confident that we will withstand whatever the travel impact might be.
So there's no guidance right now that you're waiting on from the governor?
There is guidance that we're waiting on from the governor. It is still a little bit away, so we're waiting to see that. But I think we understand the writing on the wall, which is that we will no longer see these restrictions in place, and I think that's reasonable given what we know. But I think the final details, of course, will illuminate what we end up having to do.
Thanks.
Dr. Lewis, I'd like to go back to the topic I talked about last year, which is mental health. You're aware of a year in. How do you gauge the county's mental health, especially when people have talked about twin pandemics of inequity and COVID? How do you see the county coping mentally with both of those pandemics, and how do we come through hopefully stronger together, as you said?
Well, the chapter on the impact of this pandemic on mental health is far from written. I think it's very safe to say that it is a trauma like any other trauma we might think about. I think that gives us a framework through which to consider how we think about trauma in clinical settings, to think about how we prevent trauma outside of clinical settings, in our homes, in our neighborhoods, in our communities, in our churches. I think it gives us a vehicle for driving forward. Trauma-informed care is not new to healthcare. It's not new to social services. I think it will serve as the structure around which we will need to adapt. We don't yet know what the impact of social isolation among our kids for now almost a year will be. But I think that if we can label it what it is, using language appropriately, calling it trauma, I think we stand in very good stead to address this going forward. But one of the far overlooked pandemics throughout COVID is the impact of mental health, and it is emblematic of how we've been proceeding for decades in healthcare. We have not given proper attention to mental health and mental illness. It resides very well in public health, but we've not been supporting it, not funding it, not prioritizing it nearly like we should. And if there's anything that's good that comes out of this pandemic, it will be the recognition of the importance of public health and mental health being issues that we need to prioritize and think about.
As a follow-up, how do you see it? I know that the county executive has mental health in his priorities, but how do you see this going forward in trauma in anything? COVID is one example of trauma, but all the micro and macro traumas that people experience, and keeping that in the forefront as we move on to the next thing.
When I joined the health department now 5 years ago, I took this role with the vision that we would somehow better integrate the community with our healthcare systems. And I think mental health and trauma are sad but unfortunate opportunities for us to do that. So much of what happens in the home is invisible to us in the clinic and in the hospital. We spend great lengths in the hospitals and in our clinics trying to understand trauma, and it's not enough. We don't hear enough from schools and churches and community-based organizations. I think that is where we need to go, trying to figure out how we integrate the information across these settings for the benefit of our people. I think that's where we need to go.
Question on that, just to follow up on aspect of mental health. Hopefully you can hear me through the mask. So in speaking about this with various medical practitioners and hospitals and senators, as I understand it, when it comes to mental health, it hasn't been considered as, it hasn't been incorporated in public health in a way, and that part of the issue now is getting the kind of data that would be necessary. So for instance, we're talking about trauma, and we talked about
we've been at this for years. When we think back to ancient history, which is not history, the opioid crisis, very much with us today, we worked very hard to try to understand the impact of the addiction epidemic on our community. It served as a vehicle for us to try to figure out how do we get mental health and behavioral health data out of all of the silos and into the places where people who are available and ready and trained and willing to help can do their thing. We haven't gotten there yet. We need to keep working on that. But this isn't our first rodeo. This pandemic has shined a light on the importance of data, and my hope is that as more people in our community and in our society recognize the value of data in shaping policy and clinical practice, I'm very optimistic that things will improve going forward.
I have a follow-up, but it's for something so this is, Dr. Mayo, you mentioned this a bit, that for both of you. Certainly, after a month ago, I don't know how much of the fact, the New York, the New York academic group said that while COVID-19 is a public health crisis, so too is racism. And so I'm wondering, as equity in terms of vaccine distribution has been one of the Fed's top priorities, I'm wondering for both healthcare systems, is there anything in place to ensure that you're addressing equity, racial equity in healthcare, not just access, but also quality?
Yeah, great question, and obviously we're very concerned about equity. As far as the University of Rochester Medical Center, we get doses of vaccine directed to us for specific populations, which include our employees and other 1A workers outside. And only if we have vaccine left are we allowed to administer it to patients. But each week we've had several hundred doses left, and we send them to our spoke from the hub. If you've heard of the Finger Lakes Hub, led by Nana Bennett, there's a spoke that comes to the U of R, and we're directed to give it to our UR medicine patients, similar to what's happened at RRHS. And we give it in a randomized fashion to all of our attributed lives. And we have 2 randomizations. One is specifically you need to have a city zip code in order to be randomized. And then we have a second randomization of all of our patients, whether you're in the city or not. So underserved in the city get 2 shots of being randomized. But the amount of vaccine we've been administering to our patients pales into comparison to what's done at the Dome or elsewhere.
I don't mean to interrupt.
Sure.
Just the point a little bit more. The question I was asking, or forgive me if I was being unclear, is what other aspects of healthcare, how are you ensuring that there is equity, not just of access, but quality of that healthcare?
Yeah. So we're partnering with the community in a number of different ventures, looking at primary care down in the city in areas and with physicians that the community trusts. We are working with the community on, you were asking about mental health, and developing a policy with the community that helps mental health crises, so that our police aren't put in the middle of a situation where they're not trained to care for. So in those ways, we're working to bring the needed medical care to the area rather than expecting patients who are underserved to somehow find us, both for mental health, but mainly for primary care. And as you look at the data that we have from Rochester, there is a significant number of a significant increase in the black population of COVID compared to the white population. But the data also shows that once they get to the hospital, their outcomes are better than their white counterparts. So it seems that we need to do a better job of prevention and primary care to help patients that are underserved from getting COVID and other diseases and comorbidities that may lead to them getting COVID and then sick enough to get in the hospital. But once they get to the hospital, there's less of an issue. Does that get at your question? I'll let Rob answer.
Yes, there's so much to be done. Rochester Regional Health has had decades-long commitment to serving the underserved. That's evidenced in our 26 federally qualified health centers, the refugee immigrant clinic that we own and operate, the very extensive behavioral health network that we also provide to serve the community, and there are many, many other programs. There's still more that we can do. We are continuing to look at this. We have, in the last year, implemented a diversity, equity, and inclusion leadership team to help us more closely understand and find real sustainable solutions. So there are many things that have been done. There's still much more to be done.
Actually, I'd like to speak with Dr. Mendoza real quick. Good to see everyone in person. Not their computers. Dr. Mendoza, first I just want to follow up on the question Patrick asked about travel. CDC guidelines still recommending you don't travel. State guidelines say no longer need to quarantine. Sort of a mixed messaging there. Throughout the pandemic, maybe that's something you've encountered and had questions like, who do I listen to? What's your advice for people who maybe are just getting mixed signals about what they should do?
As you mentioned, this isn't the first time we've gotten mixed signals, and I think that's a reflection of the fact that science changes, guidance changes, the way we look at findings changes. I think here in New York State, primarily we follow what the New York State Department of Health indicates and the governor's office, so we have to follow that. But there are times when the CDC guidelines are not exactly in step with that. And so I think it's important to communicate what those differences are so that people understand what the differences are and understand that we, for now, have to follow the guidelines that we have to follow. But I think it's helpful to know what in the CDC guidelines might be different so that we can adapt and anticipate if that's the direction that things end up going, or if there's an opportunity for us locally to shape things in a little different way. If we have that latitude, then we can communicate that to the appropriate stakeholder and they can make a decision on their own. But in general, we follow the State Department of Health guidelines as much as we can, and if it's silent on an issue, then we'll step in with additional guidance.
I want to talk about like the big picture thing here too. A year ago today, we didn't know what it would look like 1 year later. I know you don't have a crystal ball, but what are your hopes, I guess, for the next realistic hopes based on what we do know? Where we'll be when we're talking 1 year from today?
1 year from today, it's hard to imagine what 1 year from today will look like. I am really focusing on the summer. I think most of our community is focusing on the summer, focusing on what we need to do to get there. And I think that if we can continue our efforts with the vaccine, and as I've said before, I think the vaccine effort will evolve as we go forward. The first months were early adopters, people who may not have needed as much communication, education, and clarity. But as we go forward, we'll be encountering those who may have a different perspective. And I think we need to continue to evolve with the vaccination program to ensure that we don't just assume that what worked in February will work in May. But I think if we can succeed with that, and if the summer last year was a prediction of anything that is going to happen this year, I anticipate that the rates will go down. Warmth will bring us out. We know that outdoors are far safer than indoors. I think that will put us in a good position so that what we anticipate will be the beginning of vaccinations for children, 16 and under. With all of that combined, I think that puts us in a very good position to have a much more normal school year next year.
Yeah. Questions for Mr. Bello. You stepped into your role of county executive just before this pandemic hit, and I was wondering if you could reflect on that 1 year later. Just surely this no one could have foreseen this, so through that.
No, certainly not. And I do reflect on that. When I was running for office, I don't think the word pandemic ever crossed my lips. Never came up at a debate and a transition report either. But This is what I do know, and I will say this: leading this community is the honor and privilege of a lifetime. And I think anybody who's had this job will feel that same way, regardless of the challenges you're going to face. And when you come into public service and you lead a community, you have to be prepared to address whatever it is that comes at you, right? You know, you think back, you know, I think it's the 30th anniversary of the ice storm, right? The county executive at the time didn't know anything about an ice storm either, right? But this has been a long, year-long process. But one thing I did know is that when we transitioned into office, we were very intentional about bringing in the community and stakeholders, because one of the challenges I think we've had for over the last several decades is that we have a history and reputation of operating in silos. We have a lot of people doing really great things here, working together. You know, we have hospital systems that are doing a great job, educational systems, but they don't collaborate very well. And so we cooperate, we just don't collaborate. And so we were very intentional with our transition report and coming up with a priority setting and agenda setting to bring stakeholders together to come up with solutions. And that is really what I'm incredibly proud about over the last year, but that's really what the community response has been to the pandemic then, has really shown that we can break down those silos and work together to solve problems, right? And every day it was a new problem during the pandemic, especially during the early days. We had a different problem every day. But we knew that we could rely on our community partners to put down the swords, put together whatever competitive nature that we have in us, and work together. And that's, you know, starts with the healthcare systems. We were doing community events right off in January. You know, when I didn't even know the difference between what's coronavirus versus COVID-19. I think I asked one of these guys right before we went out to a press conference once, why are we calling it two different things? But straight through, how do we deal with food distribution? How do we deal with eviction, people facing eviction and foreclosure? How do we deal with educational disparities? How do we deal with access to the internet, kids learning at home? How do we deal with all these various things, even down to, you know, one day we're facing a challenge of, I remember when I was told one day that the morgues were filling up at the hospital, which is something that a community leader never wants to hear. And they said, how do you want to fix that? Okay, no one's ever asked me that question before in my life. I've never had training on how to do that in my life, but I knew people who did know how to do it, and we relied on them for help. And that's how we got through this pandemic over the last year, and I would have it no other way. We've really worked together, and I'm really proud of that fact.
My follow-up question would be for the chief medical officers. Could one of your, both of you just talk about where hospitals sit a year later? The hospital staff and the medical system, of course, has been put through the ringer the last year. Where do we stand now, and how's that, you know, how's everyone in the hospitals doing 1 year later?
Well, there's been a tremendous number of changes in the practices, procedures that are commonplace in our ambulatory and inpatient settings. So every aspect of the delivery of care has been impacted at Rochester Regional Health, and I'm sure at all health providers' settings. Our nurses and our doctors naturally do feel a sense of relief. Our number of daily sick calls has diminished dramatically, of course, and so we're grateful that our team members are healthy and feeling healthy. Many of them are readjusting to restoring more normal functions in the health system. We had over 1,200 employees who were redeployed to work shifts and work in clinics or on inpatient units that they do not usually work on, to support the overcapacity challenges of the pandemic. So those folks felt displaced for a time, and now they're rebuilding their own teams again back in their home units, in their home clinics. So there's just been a huge amount of upheaval and change. But our teams are still doing an incredible job of stepping forward. So this past week, for example, one of the opportunities that came to the county was to provide J&J vaccine to inpatients who are being discharged. And there was a complex screening process to identify the eligible patients. And we had doctors and nurses who stepped forward and volunteered and worked through the weekend and worked through the evenings to do extra work to get that done. So there's still a tremendous spirit of commitment to serve the community, and that is very, very heartening.
Thank you for the question. The good news is our faculty and staff are getting back to normal and doing much better than just a few months ago. As for our community, for our healthcare providers, there were some very dark days. Taking care of patients, the struggle of having to wear PPE, put it on, take it off, worried about their own families, worried about the patients they're taking care of, worried about who's going to watch the kids, worried about loved ones' jobs, just like everybody else. And so we've had a lot of town halls. We had developed supports through EAP and other areas to help our faculty and staff through this. I am concerned, as people had asked, about the long-term psychological and mental effects of this. And you know, there's concern that some of our faculty and staff will have PTSD from this. This was a trauma for a lot of our faculty and staff. But we're doing better now. The call-in rate for being sick is way down. Mood with vaccination is way up. The fact that the number of COVID cases is going way down, more and more people are getting vaccinated. I think this hope for an end to this pandemic has livened everyone up, and right now doing much better. And as I said during my brief statement, I'm so proud of our faculty and staff for what they've done. They're really heroes for helping the community get through this. So thank you.
Thanks, everybody. Thank you all. Great seeing everyone.
That's good, that's right. You know, I probably wouldn't have ever met the comedy. I knew Mendoza.